JV Camp is no stranger to doctors' offices. For the last 7 years, he's dealt with a heart murmur, getting a checkup annually. But in June, he started noticing some symptoms that were a little out of the ordinary.
I experienced shortness of breath, weakness.
Camp says he tried to ignore it.
I was in denial, nothing wrong, just a little overweight, getting old, out of shape.
But after some convincing from his wife, he decided to move that appointment with his heart doctor up.
My aorta valve had really shrank and preventing blood to go through like it should.
Sending him to Baptist Health here in Little Rock, cardiologist Dr. Evan Watts had to run some tests.
He was found out to have a specific type of anemia where he's not producing enough red blood cells. In addition to that, we found out that he had some pretty severe blockages in his arteries that would need to be treated.
All of this had to be done before Watts and his team could tackle the problem Camp came in for. While that can be a lot to handle for a patient.
After discussing this with Dr. Watts, I had no concerns at all, and I can say that with all honesty.
Once those issues were resolved, the doctors then had to figure out which procedure would be the best option to take care of Camp's heart.
I did not want to go through open heart surgery because I've seen my dad suffer through it.
After talking through the risks and the benefits, they decided to do what's called a TAVR procedure.
We typically go in through one of the femoral arteries down in the leg and advance a transcatheter valve delivery system to deploy a new valve.
It's minimally invasive, and Watts says it gives patients a better quality of life.
And this meant a lot to me. And I went into the procedure with full assurance that everything's going to be okay.
Now, just a few months later, Camp is back home and feeling better than ever.
They gave me my life back, and I really believe that.